Transition. Transition phases are a very important part of this exam. These are very easy. These are the scoring point, and these are just you will easily get the points in it. And why transition is there? Transition is a part of English language, and it will provide information to the patient that you are shifting from one point to another. How many transition? At least 3 to 4 transition has to be done, and transition has to be very well planned in advance. Every time you practice, just have the transition pre-plan and perform accordingly. I'll give you the few examples. Suppose now after completing the history and first complaint, you ask your complaint deeply and then you move on to the past history. So how to say that? So you have to say the patient, now let me ask you about your past medical history, or now let me ask you about your past history. Then patient will nod or say yes. So this is the transition which I did. So you have to do at least 3 transition. You can also do it in the family history. Now let me ask you about the family history, and in sexual history too. Now let me ask you about your sexual health and practice. So these are the transition. You can even add about menstrual history. Now let me ask you about your menstrual history. So this has to be very well planned in advance, and it has to be practiced a lot. Then it will be just come in your flow only, that as soon as you reach the past medical history, you will say this only. As we have talked about the sexual history, let me just tell you that as we say that now let me ask you about your sexual history, sexual health and practice. But before that, let me tell you that whatever we talk will be highly confidential between you and me. So this is a confidentiality statement which we have to include with the sexual history. So just keep in mind.